This is Ed and Pat Sanders saying hello and welcome to African American Health Matters.
Critical numbers of African Americans are dying from prostate, breast, lung, and colon cancer because it's been treated too late. Even more African Americans are affected by diabetes, Alzheimer's disease, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we are still needing continuing education and more about HIV/AIDS. Our surveys show we need more ways to access resources available in our community and nationally.
There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. And Ed, we need to educate our people about the importance of clinical trials. African American Health Matters is a mobile health, text message, and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. And now we have African American Health Matters on Cyberstation USA.
It's health tips for remembering to take your medication and tips on handling everything from diabetes, hypertension, and to tips on losing weight and breaking those bad habits.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com. That's all one word, www.africanamericanhealthmatters.com. Or you can call our 1-800 number, 1-800-677-8441, and someone will get back with you within 24 hours to get you registered.
Weight and health go hand in hand, and that is why your weight matters. Go to www.yourweightmatters.org. Diabetes health. Regular visits to your eye care professional is a must to prevent problems that could lead to blindness. Hypertension health. A great way to lower your blood pressure and combat the corrosive effects of plaque buildup is to exercise. Arthritis pain. Don't just sit there, exercise. The best time to exercise is when the inflammation has already calmed down. Heart health. If you have a dog, think of the dog as an exercise machine with fur. A brisk walk is good for both of your hearts. Heart flutters. Your heart needs vitamins and minerals that aren't in our diet. Magnesium, calcium, iodine, and B-complex are 4 heart supplements.
The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained, they have diverse backgrounds, and when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case, and then that case is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
When people call us, they're desperate. Every avenue available to them to solve the problem has not worked, and it's their life that they're fighting for. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. We can do that for you.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
For more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274.
Arthur T. Dean spent 31 years in the U.S. Army, retiring in 1998 as Major General. General Dean became the chairman and CEO of Community Anti-Drug Coalitions of America, or CADCA, in August of 1998. His responsibilities as chairman and CEO include providing strategic direction, diversifying and increasing funding, leading the board, primary spokesman for the organization, and overseeing the operation and personnel of CADCA. Welcome, General Dean. Thank you for partnering with the African American Health Matters.
General, tell us, I know a lot of people are wondering, but what is Community Anti-Drug Coalitions of America, and who do you actually serve?
Well, we like to call ourselves CADCA,
Okay.
which is Community Anti-Drug Coalition of America. We are a private membership association. We were created in October of 1992, so we'll be celebrating our 20th anniversary next month.
Oh, wonderful.
Very good.
Great.
CADCA was developed by the President of the United States. He held what we call a President's Drug Advisory Council, made up of 54 distinguished Americans from all walks of life, law enforcement, academia, corporate America, private citizens, you name it. And they met for 3 years because the president was getting requests from communities as to how best to push back and address substance abuse at the community level. And these distinguished Americans recommended after 3 years that a not-for-profit private association be created, and CADCA was created, and our mission is to build the capacity in local community, multi-sector coalitions so that they have the skills necessary to build and maintain healthy, safe, and drug-free communities.
Okay.
That's what we do. We've been doing it for 20 years, and we know that when communities come together, organize themselves around our model, and we'll talk more about that, there's excellent evaluation that says those communities will have less substance abuse rates.
That's fantastic. It really is. So how do the community coalitions help prevent substance abuse?
Well, we believe that there really isn't a national drug problem, but there are a series of local drug epidemics. And what I mean by that is each community is unique in its characteristics and its problems, but they all are deserving of national, state, county, city, and local support. And when coalitions, and I define that as when the sectors of a community come together, and I would define the sectors for you, they all retain their own identity, but they work together in a holistic, strategic way to push back against substance abuse. They can achieve great results, but if the police department is working independent of the faith community, and they are working independent of the education community, and they are working independent of private business and parents, you won't have the same synergy, nor will you have the same results.
Yeah.
So we believe that a coalition should have about at least 12 of these sectors working together. The civic organizations, everyone that I talked to you about, law enforcement, government, health providers, education, parents, all coming together to work the problem. They can, in fact, if you do it over these multi-sectors, over these multi-strategies, the young people in the community will begin to realize that the voices are united and that there may be something wrong about this.
Yeah.
If you are at a after-school sports clinic and the leader of your sports program warns you about substance abuse in an intelligent, informative way, you go to a doctor for your back-to-school visit, the back-to-school physical, and they also do the same thing. If you're in a youth program at some faith service, regardless of what type, you will get the same message. If you get that message in school, that's what coalitions are all about. When they do this, they are very powerful and they have a significant impact.
That makes a lot of sense. How many CADCA coalitions are there?
Well, there are over 5,000 now.
Wow.
In the U.S., in all types of communities, from Native Americans to people of color, African American communities, intercity, suburbia, rural, and as I stated earlier, going back about 5 years, we started taking this same community-based strategy internationally, and we started in Central America, South America. We're now in Asia. We are in the former Soviet Union countries as well.
Great.
We're in Africa.
Wow.
We're getting ready to go to Iraq.
Wow. You don't think about drug abuse being in some countries, but you're right. I guess it is.
Yeah, it really is. Many of these countries like Colombia, South America, we've always known them as being a place where we got drugs from.
Yeah.
But they're having internal drug consumption problems. And think about countries like that, like countries in Africa where drugs transit through. They don't have even the resources we have in the United States to combat this problem, and therefore they're having serious problems. But we have them in the U.S. as well. Some data would say that for those who are in need of treatment, we may have, depending on where you are, about a third of the capacity that's necessary.
Now, we know that substance abuse is really a huge problem, but how does it actually affect the African American community?
Well, it impacts all communities, but I want to just give you a few data points about the African American community. When we look at national survey data as it relates to drug use and health, and this survey is put out by Substance Abuse and Mental Health Services Administration, which is a part of Health and Human Services Administration. They find that alcohol and binge drinking rates were lower among black adults if you look at those that are 18 and above. For example, national averages for adults are about 44% in the black community, by 55% for everyone else. And that's for alcohol use, and for binge drinking, it's about 21% in the African American community and 24% in other places. But the rates for illicit drug use is higher among black adults than the national average, almost 10% for illicit drug use, by about 8% for the national average. Now, if you look at young people, teens, those between 12 and 17, and when you compare the national average, black teens, again, have a lower rate of past month cigarette use. They run about a little less than 6% compared to 10%. Alcohol use, they are less again, a little over 10%, vice is 16%. Marijuana use is about equal, a little bit less, but not much, 6.5% to 6.9%. And we're concerned about the use of marijuana in the black community.
Yeah.
We have seen an increase in the rate of marijuana use among black adolescents increased from just under 6% in 2008 to approaching 8% in 2010.
Wow.
So we really are very concerned that our young African American teenagers are consuming more and more of marijuana,
Yeah.
and that is something for all of us to be concerned about.
Yeah.
Well, speaking of marijuana among teens, why is marijuana increasing so much among our teens nowadays?
Well, for a while, if you go back to the late 90s, there's a little history. Go back to the mid-90s, we had a spike in marijuana and illicit drug use. We really came together as a nation, and we saw a decrease starting around the early 2000s, and it lasted for about 5 years. As a matter of fact, there was about a 20% decrease.
Mm-hmm.
But after about 2005, we saw these numbers begin to creep back up.
Mm-hmm.
When attitudes soften, when significant people in our young people's lives, whether it be a coach, whether it be a teacher or parents, do not express disapproval in a very direct manner, teen use begins to increase.
Okay.
And also, when their perception of the harmfulness of the drug begins to decrease, we see an increase as well.
Mm-hmm.
So all those things were working against us, and I'm sure your audience will remember that a few years back, started in California, there was this big push on something that they call, and I put in quotes, medical marijuana.
Right.
We don't think that such a thing exists because the Food and Drug Administration has never classified that smoked marijuana had any medical properties in it.
Mm-hmm.
But they began to have this big push, and they called it medical marijuana.
Mm-hmm.
And now they've gotten about 15 states to vote through the ballot box medical marijuana in. We don't know of any other drug that has been classified to have medicine that's been done at the ballot box. All other drugs are done through the Food and Drug Administration.
Mm-hmm.
So with this kind of atmosphere going on, and we've had a couple of states to actually have on the ballot to actually legalize, not just for medical purposes, but to legalize it for recreational purposes. Fortunately, those initiatives were defeated. But what it does is it causes our young people to perceive that it can't be that harmful. If the title medicine exists, if states are considering legalizing it for recreational purposes, and as a result of that, we've seen these significant increases, and that's very troublesome.
Yeah, and prevention. I think prevention is so important at this stage. It is really the key. What are the preventive steps that parents should know about, General?
I would say to you that first thing that parents should do is talk to their young people, their children, often and very early. It is never too early. There's some research that says by the time a kid is in the 5th grade, he or she would have been exposed to these substances or at least know about them.
Yeah.
And therefore, parents need to make sure that they are having good conversations with them.
Absolutely.
Parents need to, we know that it's very difficult for parents to carve out good quality time to spend with their kids. But there's lots of research that says when parents are involved in activities with their kids, when they take them to some form of faith worship on Sundays, they're with them at their Little League activities, having dinner with them around the dinner table. All of these activities help to build down their youth.
Absolutely. Absolutely.
Finding a way to spend quality time with your young people. Building a relationship so that they understand that when there's a problem that arises in their life, that the first person they can turn to for help and assistance is their parents.
Well, yeah.
You know, if they are of age to be out alone, making sure they know how to reach the parents when the situation arises that they are concerned about. Telling them that, you know, if you're at a party or you're at any event and you're uncomfortable and you want to get home, call me and I will come take care of the situation and bring you home. You know that they can really trust and depend on them. And talking to them directly about drug use is the key.
I agree.
You just can't, you know, beat around the bush. You got to be very direct.
Gotta be direct.
And have them understand the consequences of drug use, the impact it's going to have on their development, both mentally and physically. The fact that you disapprove of it, that they're not going to be able to do well in school, they're not going to be able to participate in sports, they're not going to be college ready after high school if that's what they want to do, they're not going to be employment ready. Many companies now test young people before employment for drug use. The armed forces test them for drug use, and it's becoming a serious problem. They are not performing academically, and they are not ready for any type of schooling or college or employment or the armed services if they're using drugs.
Yeah, that's true. And the reality of it, General, is that all parents are not good parents. And so that's one of the reasons that we think that CADCA is doing an excellent job with outreaching to the coaches and the teachers and the others in the community. The old saying, it takes a village. I think you guys are really adopting that approach.
And you know, and the other thing I like to say is that, you know, some people like to say, you know, gee, marijuana, just like a bottle of beer, what's the big deal? But there's lots of research that has been produced that says it impacts negatively one's IQ. They tested in a trial over 1,000 individuals at the age of 13, and then they tested them again at the age of 38. And they found those that had significant marijuana use had an average of 8 points that they lost on their IQ.
I can believe that. I definitely can.
So it is not a benign substance. It does have an impact. And Dr. Noah Volkov, she is the director of the National Institute on Drug Abuse. It's a part of the National Institute of Health here in Washington, and most recently published a study. The finding is consistent with the notion that drug use during adolescence, she says, when the brain is still rewiring, tuning itself, and organizing itself, it can have a significant negative and long-lasting impact
Absolutely.
on the brain.
That's right.
That's excellent.
Some people used to think, you know, that by the time you were in kindergarten, your brain has been pretty much developed. We know now it's up to 25.
That's right.
That your brain is still developing.
Still developing.
And and if you're using substances, whether it be prescription or over-the-counter medicines,
alcohol,
or whether it's illicit drugs, you know, when you are 12 and 13 and 14 and 15, right in the middle, good brain development and brain growth, look at the negative long-term impact it's going to have. And we need to have parents understand that and explain that to their young people so that they can make wise decisions.
I understand. Well, we're grandparents, so we understand that double. We certainly do, for real. General, it has been such a pleasure to have you on African American Health Matters on Cyber Station USA. Okay.
Do you have a couple minutes? I want to give you a little quite a summary?
Please do.
Go ahead.
Yeah, one of the things that we hear about, and you know, I'm African American myself.
Okay.
In our community is that so many of us are locked up for drug use, and if law enforcement people didn't do that, we wouldn't have so many young men, particularly
Black men. Yeah.
So the research says that there are more young African American men locked up in jails than there are on all of the universities across America.
That's right.
But when we look into that research, and I want the African American community to hear this, because we care dearly about young African American men, and we want them to exceed and to be successful.
Yes.
But what we find is most of them that are locked up is because of the criminal activity that they did to get their drugs, or they did after their drugs, and not just for drug use.
Yes. Yes.
And that's the challenge we have to
That's right.
everyone understand.
We sure do.
If you're out robbing someone to get money for your drugs, that's very different than you being locked up just for using.
That's
that
right.
just doesn't happen.
That's right.
That's true.
In very rare cases are people locked up just for using.
Very good point.
Very good point.
I tell you, parents have more influence on their young kids than they think.
Yeah.
Yes, peer pressure's there, you're right. But if you have really, really worked with them, they're going to fall back.
You're right.
And remember what they heard from mom.
You're absolutely right about that.
If anybody wants more information about CADCA, Community Anti-Drug Coalition of America, they can visit us on the web at www.cadca.org.
Great.
We're on Facebook. We're on Twitter. Excuse me.
That's okay.
And we have a toll-free number as well.
What is
1-800 CADCA, CADCA 54. We would be more than pleased to answer any questions or share information about the coalition in their community that they can connect with, I'm a part of. And if there happens to be a community where they don't have one, we certainly would help them organize one, and it can provide them with information on things that they can use to inform themselves to be better parents and providing information and helping their teenagers.
Fantastic. Okay. That's 1-800-CADCA-54. Thank you so much, General.
Hey, I'm former NFL linebacker Chris Draft. Cancer's hit close to home for me, and I wanted to do something to fight back. That's why I'm proud to partner with the American Cancer Society by enrolling in the Cancer Prevention Study 3, a once-in-a-lifetime opportunity to be part of research that may change the course of cancer forever. To find out how you can help the American Cancer Society save lives and create a world with more birthdays, visit cancer.org/CPS3.
Did you know that African Americans have one of the highest rates of asthma? Asthma is a lung disease that makes breathing difficult for both young and old. Although there's no cure for asthma, it can be managed and treated so you or your loved ones can live a normal, healthy life. You can be as active as you want to be. The American Lung Association can help. Learn more about asthma and keep it under control by visiting www.lungusa.org or call us at 1-800-LUNG-USA.
We want to thank our sponsors, Dendrion, American Medical Systems, Sanofi Aventis, Genentech, and C.R. Bard.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyber Station USA.